Warm greetings to one and all. Let's wait for a couple of minutes while we admit the rest of them. Hope you all can hear my voice clearly. So once again, this is Dr. Anita Sargent, your MC for the session. If you wish to claim your certificate for the same, kindly visit our website, which is www.onlinedentistry.in/9 p.m. and register for the same. Online dentistry has been the pioneers in providing dental education via both online and offline platforms. The motto we preach is to redefine dental education. It has been over 14 years that online dentistry have been conducting sessions for clinical practitioners across the globe. Established in the year 2008, so far we have covered over 203 offline courses and have conducted 1,022 online courses with an enormous amount of more than 30,000 followers on our platform. Let me proudly introduce the CEO of online dentistry, Dr. Manu Abraham, who is one of the finest practitioners in town, an orthodontist by profession, a passionate photographer, and he owns his private practice at Kerala Dental Clinic, Aluva. Currently, he's interested in educating thousands of clinical practitioners through online and offline sessions. Moving on to the academic head of online dentistry, Professor Dr. Joby Peter is currently the HOD of Department of Pediatric Dentistry at Manu Dental College, who preaches the philosophy to catch them young and watch them grow. Over the years, we have grown dynamically, launching 10 centers in different parts of India. The latest addition to our courses, the one-year comprehensive and advanced master training program on interceptive and myofunctional orthodontics, have been successfully initiated with 2 batches. So basically, this is a multidisciplinary program with intense training and hands-on sessions. Our program is now a fellowship program on interceptive and myofunctional orthodontics, which is accredited to the Manipal University College, Malaysia, which is also a sister concern of Mahi University. Herein, 2 of the modules will be happening in Malaysia, along with the graduation ceremony and a certificate distribution as well. We are open for registrations for the next batch, which commences on September 22nd, 23rd, and 24th via our website. You all can always feel free to reach to us on our WhatsApp number or visit our website, which is www.onlinedentistry.in, or else you can mail us on onlinedentistry.in@gmail.com. Online dentistry have been conducting sessions all over India for the past 14 years. During the lockdown, we started conducting online sessions to benefit the practitioners, which have been received with great appreciation from the dental fraternity. And also in the year 2023, we are relaunching the same by providing free advanced learning series under the title Online Dentistry at 9 p.m. So without further ado, let me move on to introducing the speaker for the day. Dr. Manu Johns. Dr. Manu Johns graduated from Ma Basilius Dental College, Kodamangalam as the best outgoing student. He completed his MDS in prosthodontics with the 6th rank from Rajiv Gandhi University of Health and Science. He secured several awards in his undergraduate time itself for both curricular as well as extracurricular activities. And to his credit goes numerous publications in national as well as in the international level. Currently, he is working as a reader in Manu Dental College, Moatupra. Proudly welcoming the star of our session, sir. The session is all yours now.
Thank you, Dr. Anita, for your kind introduction. I am overwhelmed. Let me just share my screen. Good evening, one and all. I hope you can see me. So I am Dr. Manu Johns from Manu Dental College. First of all, let me thank the organizers of online dentistry platform, Binu sir, Joby sir, Dr. Joe, Dr. Anita, for your kind support and giving an opportunity to present over this platform. So Implant ARMOURY, that's the topic for today. And before starting, let me wish Eid Mubarak to all my friends over the platform. So where do I start when I talk about implants? When I started practicing implants a decade back, implant in our department was in its budding stages. Nobody used to place implants, but I was lucky that I had a kit of my own when I started my postgraduate curriculum. The department had a physio dispenser. The kit that I had got was from a close friend of mine. He gifted it to me. So the chance favored me. And by God's grace, I got a patient before my seniors got, and I started placing implants. But after I graduated, I didn't have a physio dispenser of my own for a couple of months. I was thinking, I will place implants when a patient comes to me and I'll buy a physio dispenser. And it never happened. So I bought a physio dispenser of my own. I bought the accessory gadgets, and then came the patients, and it never stopped. So before starting this presentation, to share my thoughts, what I would say is that if you want to practice implantology, you should be prepared for placing implants anytime. I'll start this presentation with a small clip from a Malayalam movie, which was an epic movie.
ഒരു കാര്യം ഞാൻ പറഞ്ഞേക്കാം. നിങ്ങൾ ആളിനെ കാണിച്ചു തന്നാൽ മാത്രം മതി. യു സീ, ഐ ആം എ പ്രൊഫഷണൽ കില്ലർ. നാടൻ മലപ്പുറം കത്തി മുതൽ അൾട്രാ മോഡേൺ മിഷൻ ഗൺ വരെ 5 കിലോമീറ്റർ ദൂരത്തേക്ക് സൂം ചെയ്ത് ഫയർ ചെയ്യാവുന്ന ടെലസ്കോപ്പിക് ഗൺ. ഇത് അമ്പുമില്ല് ഗൂർഖ ഗറില്ലകൾ ഉപയോഗിക്കുന്നത്. പിന്നെ ബോംബ് ഉണ്ടാക്കാനുള്ള മെറ്റീരിയൽസ് ഉണ്ട്. ടൈം ബോംബ്.
So most of the participants in this meeting are from outside Kerala, but I'll just give you a gist of the story. If you are prepared with all the armamentarium, your clients, that's your patients, will be impressed with you. But there is another side of the story which I will show in the end also. So I'll start with a case that I had done a couple of years back. As you can see a very good implant placement in my language. A 13 mm long implant was placed. The patient was from abroad. She wanted to go back in a month's time. So I had to go ahead with immediate loading, which means I'm placing the implant and I'm placing the crown also within a couple of days. I placed the crown, gave the patient the instructions, and she was happy for a couple of days. But she was telling me that there was no issues for a couple of days, maybe a week. And what happened after that? The patient called me after 2 weeks' time, telling that, Doc, there's a small pain in that area. I called her back, took the x-rays, and to my worst nightmare, what I could see was the entire bone around the implant was gone in the wind. So what would have happened? I had instructed the patient after the implant surgery and after placement, immediately after placement of the implants, not to chew on that side, hard food. See, she obeyed it, but after a couple of days, she started eating soft food like chapati in milk. So what I had really missed is a proper post-implant placement instructions, which resulted in the loss of the implant. That's what happens. If we are not prepared with a proper thing, you can lose your implants. To start with, what is the must-have armory in your implant practice? I would say it would be an proper informed consent. Okay, so I will give you the copies of the links of the informed consent and post-implant placement instructions by the end of this talk. So let's start. Before starting with the implant inventory, you should have the backup of the other things like a pharmacological armamentarium, which consists of antibiotics, painkillers, and emergency drugs. By emergency drugs, you know what all are the emergency drugs that you need. Let's hope we are not going to use it. Let's hope it expires and we replaces it. But you should have it all the time to face an emergency. Of which the most important while we are doing an implant procedure would be hemostatics, Abgel or bone wax, a BP apparatus, and things like that. In the drug section also, you might already know oxygen, epinephrine, nitroglycerin, and things like that, which I'm not going to go into the details of it. Okay. Let me just pause for a moment because my slideshow is just jumping off. Dr. Joe, I will just stopping for a moment. Is that okay?
Sure, sir. That's perfectly fine, sir.
It's because my present slides are jumping automatically. I think it's in the play mode. Let me see. I can stop it, right?
Yes, you can, sir.
And I will share it again. I think there has been some issue. Function. Right. Yeah. So these are the emergency drugs. And where do I start? When you're planning to start an implant practice, your implant inventory or the clinic that you're practicing should have a couple of surgical trays. Because when you have things arranged in an orderly fashion, you can practice implantology in a better way. So the trays that you need is an instrument tray table, a supply table, an implant motor which has been placed on a table, and a dental chair. So without these trays, it's literally difficult for you to practice implantology. So what are the contents? You can arrange all your instruments in an orderly fashion that you like, and you can approach it and in an easier fashion. So the main instruments that you should have in an instrument tray should be a periosteal elevator. So previously we used to use periosteal elevators for extractions. They are huge elevators. Okay. That is not intended in implantology. We need cute ones. Small periosteal elevators like Molt's elevators, Minnesota retractors, cute artery forceps, chisels, AdSense forceps, a titanium suction tip is all preferred at the time of implantology. There are kits which comes with a lot of instruments, but I would say if you are really planning to go ahead with implantology, try to procure one instrument at a time so that you have a proper inventory when you start with your implant practice. These are different implant inventories that is available in market, which consists of bone gauging, mapping instruments, scissors, artery forceps, Castro-Vego needle holders, bone wells for holding your bone graft materials, and things like that. If you are really interested in buying these things online, our Dental Cart, which is an online shopping application, has a specific company called as Dent, which supplies almost all the implant-related inventories at a reasonable price. You can go through that. So when you start with an implant setup, you can arrange all your instruments in an orderly fashion so that you don't have to search in between for a particular drill or a bit or whatever things. So the surgical setup contains a lot of instruments which need to be arranged properly. The most important of it would be an elevator, a needle holder, floors to hold the small instruments like the drills or the paddling pins, gauze, which is a sterile gauze in a specific shape. I would recommend not to use sterile cotton. You know why? When you open up a flap for implant, there is high chance the threads of this cotton can get caught into the bone or the bare bone, which can be a source of infection. So better try to get gauze, which is cut into specific sizes. And let me tell you, this gauze is available in specific sizes online, which you can buy, so that the threads of the gauze also won't come out. You can use specific blades like number 15C blade, which is a small blade when compared to the 15 blade, so that you can access the remote areas between the teeth for making an incision. And preferably try not to use 3-0 or silk sutures. Try to use eyeless sutures, which is 4-0 or 5-0. So the surgical setup in the supply tray or the next surgical table should have the accessory things. They are the cotton forceps, the X-ray sensors, sutures, alcohol wipes for disinfecting the adjacent areas, surgical loops, which we can use for lubricating the perioral tissues with a cotton applicator. You can give protective glasses for the patient, a cup with normal saline for irrigating the areas, a cup of Hexidin, which can be used as a pre-procedural mouthwash, and a camera, which can be wrapped with a barrier membrane. The surgical setup with the supply tray should have the following solvents. They are the surgical spirit, providone iodine, which can be used to scrub the face of the patient pre-procedurally, Hexidin mouthwash as a pre-procedural mouthwash, normal saline for irrigation, distilled water especially, which is sent into the dental chair, so that in case if you want to use the aerator or anything to section the tooth, you can think of you can avoid any possible contamination. And drinking water, if in case the patient gets thirsty because he or she is tensed, you can give them water. And kindly avoid these things, so that you need not have to search around these instruments for small instruments. So I'll show you a small video of how the surgical setup is done. This is not my video, I'm just posting it from online. So this video says double wrapping of the instruments and kits, so that it can be stored for a longer time. I'll just fast forward if possible. So all the instruments which are double wrapped are taken out. One of the assistants will be taking out the sterile instruments and placing it onto the surgical tray. And it is arranged as per the surgeon's wish, so that it's easy for the surgeon to identify it and take it out. It's always recommended to have with you a couple of dishes, steel dishes like this, so that you can put all your drill tips or the paddling pins or even the cartridges into this. Once all the instruments are arranged, it can be wrapped with a sterile clothing. So that's how you arrange your surgical tray. So the aim of this is to keep the surgical area reasonably sterile. So I hope you understand what I'm telling. So in the operatory, you should try to drape the surgical tables with sterile towel or paper, the instrument tray table, the supply tray table, and the implant motor table. The doctor and assistant components consist of large surgical gowns, absorbent towels, buffet caps for the doctor and the assistant, face masks, and table covers. The patient room can be set up with split sheet drapes for covering the patient's face, caps for covering the patient's head or hair, operatory room towels, surgery head drapes, chairside bags, saliva ejectors, and sterile gauze. The purpose of sterile gauze is to give it to the patient. If in case the patient is taking home the gauze, he or she can bite on that gauze, which will be helpful to arrest the bleeding. Coming on to the implant motor. So there are lots and lots of companies supplying physio dispensers, I'll try to discuss the main components of an implant motor. It consists of a display panel with a lot of buttons. Basically, the buttons are related with the speed, torque, and coolant. You can adjust the speed of the implant motor for drilling purpose, let's say from 800 RPM to 1200 RPM. And the torque is the more important thing. It should be high enough, like 30 Newton centimeters. That is the drilling speed for routine osteotomies. You can adjust the coolant supply from 0 to 3 or 4. And the best part of a physio dispenser is that it can have reverse function also. So if in case you are doing a bone expansion, the expanders will go and it can be reversed so that you can take out the expanders. And you can have programs where you can memorize these settings so that it will be easy for you to practice. So it has a foot control which you can adjust the coolant flow. You can jump from one program to other, and you can even do the forward and reverse button. Coming on to the implant system components. It contains a burr. Every implant system contains a burr to create a hole in the cortex. That is the first burr that is being used in implant dentistry. After a burr, it starts with drills that creates a bone preparation similar to the shape of the implant. So those are the osteotomy drills. There are few other drills. They are called as bone taps, which shapes the crustal part of the bone to match the shape of the implant. So once the drills are done, drilling is done, we use the implant driver that delivers and inserts the implant into the osteotomy site. Once the implant is inserted initially to the osteotomy site, you can use something called as a wrench, which can be a surgical wrench or a torque wrench, to insert the implant into the final position. So first is the round burr. So it is used to prepare the implant site before creating the osteotomy. If you have a very sharp crust, you can round the sharp crust by using the round burr. Okay. Once the plateau or the platform is obtained, you can use a burr called as a pilot drill. It's also called as Lindemann drill. It has tips and sides which is cutting in nature, and it is used to mark the osteotomy. It cuts through the cortex into the bone. Okay. Once the osteotomy is done with the Lindemann drill, you can start with the osteotomy drills, which has markings. It has markings depending on the implant system. And at the tip, there will be an excess of 0.5 millimeter. It's called as drill tip or Y point. So if the drill has a marking at 11 millimeter, the actual length of the drill osteotomy would be 11.5 millimeters. So it comes in different widths and with different lengths. You can use the specific drill for the specific implant. Once you have done osteotomies, you can check the parallelism of the osteotomy with the adjacent teeth, with the adjacent anatomic structures by placing a tool known as paralleling tool or a direction indicator. There are different types of paralleling tools, or it even can act as a dummy implant. So coming on to the implant driver, it is a tool that is used to take the implant from the casing into the osteotomy site. There are different types. One which we can use with the hand, the other one which we can use with the implant motor, and the third one which we can use with a hand implant wrench. You can see it on the picture. And the implant wrenches are of two types. One is the surgical wrench, which doesn't have a torque measuring thing in it. And the second is the torque wrench, with which you can apply and measure the amount of force that is being delivered onto the implant. So you have an arrow on the torque wrench or the surgical wrench. If it faces towards you, you are inserting the implant. And if it faces away from you, you are unscrewing the implant. So this is the torque wrench, which is shown in the picture. It has several markings. telling 0, 15, 25, 35, 50, and so on. So the normal force with which you can insert an implant, or the acceptable torque that can be achieved while inserting an implant, is something in the range of 35 Newton. The acceptable torque for torquing the abutments would be 20 to 30 Newtons, which can be measured using a torque wrench. Coming on to the implant system components, I'll show you in yet another video, which I hope won't be fast forward. This also has been presented nicely so that I had to download it online. So the implant surgical setup consists of a kit, physio dispenser, and a handpiece. The surgical kit, as I told, have drills, drill stoppers, drill extenders, paralleling guides, and things like that. This is an implant depth probe, which helps to see the depth into which you have drilled. The abutment driver or hex screwdriver are also available. There are forceps which is used to hold the abutments, and a ratchet for inserting the implant. Coming on to the surgical drills. First drill, as I already told, you can use a round drill to create a plateau or a platform. Then you will get bigger size drills to create the osteotomy site or make a plateau on the osteotomy site. Once that plateau is made, you will use the lance drill, then the pilot drill, and the osteotomy drills. So as I already told, the small carbide burr marks the implant site. The lance drill or the large carbide burrs makes the boning irregularities and flatten the sharper ridge. The lance drill goes into the cortical bone and makes the initial osteotomy. So it's also called as the cortical breaker. And you have the osteotomy drills or the pilot drills, which goes into a specific depth or the complete depth of the planned osteotomy. And once the pilot drilling is done, you can use the osteotomy drills with increasing diameters. So I'll just fast forward a bit. It has definite markings. You have something known as the crustal bone drills, which is called as countersink drills, which is run at a bigger speed to remove the crustal bone so that it takes the shape of the final implant. There are something called as bone taps or thread formers, which are run at very slow speeds so that the threads of the implant matches the threads that has been formed in the osteotomy site. This, what I'm telling, are drill stoppers, which can be inserted into the osteotomy drills to prevent over drilling. So if you want to drill to a specific length, like 8 millimeters, you can place an 8 millimeter drill stop and it will stop drilling at that spot. If you have an area which is inaccessible due to the adjacent teeth, you can use a drill extender. And whenever you are doing osteotomies, you can check the depth and the parallelism of multiple implants using a paralleling guide. And you can use implant depth probe with definite markings to see how deep you have drilled. So these are the drivers in the surgical kit. One is for inserting the implant. The hex screwdriver is for inserting the smaller components like the connection screw, the cover screw, the gel formers, and things like that. Both of it can be handpiece driven or hand driven. You can use a abutment forceps to hold the abutments while torquing it. You can use ratchets to torque the implant or the abutment to the desired torque. Coming on to the physio dispenser, as I was already telling, there are several functions and several parts. It has torque control, speed control, saline irrigation, a handpiece, foot control, and programs. I'll just run through since I have already discussed about that. Okay. So coming on to the commonly used implant systems. So if you have a practice that is having patients coming from US or UK, most of the patients coming from abroad, especially US, will ask you for a specific company, that is Nobel Biocare. They are very good implants. Their surfaces are told to be RBM treated or whatever. And the patients specifically tell that they need Nobel implants. The thing is that even though they are good, they come to the expensive side of the story. The next would be the different implant surfaces in Nobel. They come in Nobel Replace, Nobel Replace Select, and different types, Nobel Active, Nobel Speedy, and things like that. Each has its own advantages and specific indications. The next implant system would be Straumann, which is also an equally good system. Many patients coming from Germany or UK will tell that I need Straumann implants. So the type of implant system that you are going to select depends on the patient clientele that you have. This kit also has several other accessories like paneling guides, implant spacing guides, tools, and all, which makes it a very good kit. It also has different designs like abutment level or tissue level implants and so on and so forth. Another subsidiary of Nobel is Alpha Biotech Implants, which comes towards the more economic side of the story. It also has different designs, and you can select a specific implant depending on the case, whether it is an immediate placement, whether it's a delayed placement, and things like that. The next implant system would be Dentium, which is nowadays very active or very highly practiced in India. It's a Korean brand. It's also a good one. It's Dentium Superline. The economic variety of Dentium would be Dentium NR line, which has a different connection. The implant as such has an internal square connection. So the prosthetic part would be a little difficult. So I wouldn't say whether you should use a Dentium NR line in cases of prosthetic challenges. The routinely used another system is MIS, which has been taken over by Dentsply. It's also a very good system. It has also different implant designs. You can select whichever design depending on your choice or case. Like the most commonly used design is MIS 7, then conical connection, that is C1. And what I personally use nowadays is Ostem system. The specialty with this kit is that there's a lot of drills. Each of these drills come with drill stoppers. So you don't have to worry about over drilling in this case. So since all the drills are coming with inbuilt drill stoppers, you can drill in a safer way. It also has several designs like TS, SS, US, and all. You can use TS system in routine cases. If you have an immediate extraction case, you can use TS4, which is having better primary stability and other features. The most used or the most trusted brand in India would be Adil, which is marketed or which is giving excellent results. I have been practicing it since long time. It also has a very good kit and a lot of implant designs. The mostly used one would be the Adil OS type, which has very active threads. You can have close fit ones, narrow platform ones, and several designs are also available with Adil. So coming on to the implant surface modifications. So to summarize with the implant companies, you can select whichever implant system you like. It depends on your patient clientele. No matter which implant system you select, it's based on how you place the implant. The success of almost all the implant systems are similar. The case selection is what matters the most. So when I searched for implant surface modifications, there are n number of modifications that is available in market. It starts with macro modifications, micro modifications, and ends in biological modifications. Macro modifications are like the modifications in the threads, machining, grid blasting, and things like that. Micro modifications, the surfaces has been treated with acid etching, sandblasting, laser ablation, nanocomposites, hydrophilic surfaces, and so on. And in biological modifications, which is the latest trend, you can get implants that has been plasma sprayed, implants with fibroblast growth factors on it, antimicrobials on it, protein incorporated on it, and things like that. They are the biologic modifications. It all has the same results. Trust me. So coming on to the implant inventory. So we have already discussed about the surgical kit. We have the prosthetic kit. And when you are definitely planning to go ahead with implant practice, you need some accessory kits also. Like the most important, I would say, would be a bone expander kit. I will show you the video of the bone expander being used soon. And you can have the sinus elevation kit. If you are planning to place immediate loading implants, you can have an implant stability tester, a drill stop kit, PRF box, and drill guides. Coming on to the drill stop kit. Depending on a specific drill kit, that manufacturer also gives you the drill stoppers. Unlike Austin, which has already the drill stoppers in the drills, other implant systems have drill stoppers as a kit. So the advantage is that you don't have to worry about the depth to which you are drilling. The osteotomy will stop at the specific depth. If you are planning to expand bone, you can have osteotomes. These are manual osteotomes, but I would recommend rotary osteotomes or expander kits with grid split kits. This is an asset kit from Ostium, which is an excellent kit to expand bone. The reason why I am telling that is, you please see the video. This is a case where there is very less bone height as well as width. I'll play the video. Just a moment. In Indian population, when you see an extraction site or an edentulous site, the width of the bone is definitely going to be very compromised. And you are not going to get a classic ideal case for implant every day. You may get in once a full moon, but not every day. So if you have the accessory kits like an expander kit or a sinus lift kit, it will be definitely of good purpose. So this case, when I looked at it, it was a very simple case. But once I took the CBCT, there was very less bone in width as well as in height in one region. So I had to use the expander. And I grafted it and did the indirect sinus lift using expanders. This is another crustal approach sinus kit or CAS kit, which uses the same type of drills, which doesn't cut at the end, so that the chance of sinus perforation is avoided. It has even a hydraulic membrane lifter by which you can press it into the osteotomy site and inject saline so that it lifts the sinus membrane. This is the DAS kit, which is the direct approach sinus kit, which creates a window at the sides and you can lift the sinus. The trending kit nowadays is the Densa osteodensification drills, which is for the purpose of osteodensification, which means it densifies the surrounding bone by pushing the bone from the osteotomy. And it even can be used for sinus lift. Coming on to implant prosthetics. Since you all, I believe, are starting in implantology, you should know how to give a processes in implants. Once you have placed your implants, you will have something called as impression coppings. So it comes in two ways: as closed tray, where you make the impression without making an opening in the impression tray, and an open tray, where you make an opening in the impression tray and make your impressions with putty or light body. So whenever I would say, whenever you make an impression with implants, try to make it with an open tray impression technique. because the chances of errors while reseating the impression copying is minimized or nullified when you make impression with open tray impression copies. When you have multiple implants, I believe it's jumping. When you have multiple implants, it's always suggested to splint the implant impression copyings with composites or preferably pattern resins and take a open tray impression technique. So these are the parts of the implant that I was telling: the spiral implant, the abutment, the gingival former or the healing cap. You have an implant analog and then impression copy or transfer. And whenever possible, try to give a processes which is screw retained. So the implant processes can be of two types. One is cement retained and the other one is screw retained. If you can place an implant which is screw retained, it gives you an added advantage. Later, if you need a service or an evaluation of the implant, you can just remove the filling on the top of the screw and recover the crown. Coming on to documentation, ARMOURY. Whenever you practice implantology, you should publicize it with the patient's permission. Then only you will get the next patient. So you should have a proper photographic setup and a consent for the ARMOURY. The photographic setup is as follows. You can have all the gadgets that you like, but it's going to be a little expensive. And if you are planning to get a fellowship or a diploma degree in ICOI or ISOI, you should document it in a specific fashion with all the patient details, the photographs and the radiographs, pre-surgical, post-surgical, immediate post-op, and a 1-year follow-up, which has to be arranged in a proper fashion, like front exclusive occlusal, like left exclusive mandibular occlusal, and things like that. But no matter what you do, mistakes can happen. If something happens, that is big trouble. So the most important thing in implantology is case selection. I will show you this clip of the previous film that I was showing. The film star or the serial killer has all the
Listen, boy. ഇതൊക്കെ വളരെ മാരകമായ ആയുധങ്ങളാണ്. ബഫേഴ്സിന്റെ അൾട്രാ മോഡേൺ മെഷീൻ ഗണ്ണ് മുതൽ നമ്മുടെ നാടൻ മലപ്പുറം കത്തി വരെ ഇതിലുണ്ട്. Look, man, I am not a real professional killer. No, മലപ്പുറം കത്തി തന്നെയാവാം. അങ്ങനെ പവനായി ശവമാണ്.
So I was showing you this video clip to tell you about a case that I had. I had all the gadgets. I was given a case from a friend, a close friend of mine. He just gave me an X-ray. I didn't take a CBCT or any other diagnostics for the same. This was the X-ray that he sent me. It was a young male. The molar was grossly damaged. He wanted implants. So I told, yeah, simple case. It's a maxillary molar. We can just pull it out, place an implant. I placed the implant. So the implant was properly placed, but it was a little deep. So I thought I will place a gingival former immediately. But after evaluating, I thought the implant is placed little deeper. So I thought of taking it out and positioning it with little graft. So I took out the gingival former and I was looking for the implant. Just guess what happened? It slipped. My case selection was not proper. It had a lateral window and it just slipped into the sinus. And I had to work for 2 hours along with my surgeon friend, creating a big Cadwell look osteotomy on the same patient to recover the implant. So if you slip the implant, it's a big trouble. Okay. So the case selection with proper radiographs, preferably a CBCT, is always important in implantology. So I had modified my practice. Wherever I do cases with sinus lift, I use an implant with a implant mount. I'll show you this video, and I place the implant. I attach a floss onto the mount and I drive the implant into the sinus. So I can be in a safer stage. So that's how it goes. So if in case, unfortunately, the implant slips also, I can fish it out with the floss. So that's all for my talk today. My sincere thanks to Joby sir, Joe Anthony sir, Jiju sir, Baju sir, my friend Prisley and Anu Dental College. Thank you. Over to Anita for the rest.
Hello, sir. Am I audible, sir?
Yes.
Thank you, sir. So it was indeed a wonderful session. Now you guys can post your queries in the chat box. So the first question is from Dr. Ditin Gopi. Consent form, regarding a consent form, sir.
Okay, so I didn't explain much on the consent form about implants. I have just posted the slide. I hope you can see the slide. I will post it in the chat box, or the online dentistry platform will be sending the link for the consent form. Whenever you are placing implants, the first thing that you should do is to get a consent form. The consent form that I have made has covered every aspect of placement of an implant, starting from the placement, the graph, the risk, the benefits, the instructions, the signatures, and all. You can just go through this consent form, which will be enough and more while placing implants.
Thank you, sir. So I think they've understood more. So we're moving on to winding up our session. So once again, thank you, sir. So this is an honor. Thank you, sir. Thank you, sir, for being with Online Dentistry. And we have come to the end of the session. So stay tuned till second Wednesday for another punching session. Thank you all. Good night.